In this video, we will discuss boundaries in multiple relationships, as well as competence. So for a psychologist, what it means to have a multiple relationship is to have both a professional relationship with someone while also having a separate ongoing relationship with them. So this would be like being somebody's therapist while also spending social time together. And this, as you can imagine, can be full of ethical dilemmas. So what are some of the reasons why multiple relationships are potentially unethical? For one, it can impair the psychologist. So they suddenly have reasons to maintain a different type of relationship with this person, and it might change the way they're treating the client. The client is also at risk of being exploited or harmed, because therapists do have some power over their clients, just by the nature of a psychotherapy relationship. And so by having another social relationship, this could influence it by having that social relationship not be on equal terms. And we talk about the issue of boundary erosion, or what we call like a slippery slope. So at what point does it become a multiple relationship? We'll talk about some examples today where it can be an ethical dilemma, especially when you live in a small community, and thinking about where to set those boundaries. So when we think about multiple relationships, there is an ethical standard about it. It defines it as being in another role with the same person, or with a person who's closely associated to the client, or discussing a future relationship. And there's a distinction between sexual relationships and non-sexual relationships. So for sexual relationships, there's clear-cut guidelines that therapists are not allowed to have sexual relationships with their clients. But when we get into non-sexual relationships, this is where it can get a bit more fuzzy and where the psychologist has to make judgment calls. For example, for psychologists in rural or remote areas, it can be very difficult to avoid having multiple relationships. So imagine that you're living in Maui, you have children that go to the local public school, and you have a practice. Chances are you're going to have overlapping relationships with people in your community. In some towns, there might be only one psychologist available, and that psychologist is serving an important role to provide mental health care for their neighbors and friends. And so in situations like this, it likely isn't possible to completely avoid these multiple relationship situations, but they require extra caution from the therapist. They really need to be very careful about their ethical guidelines, and make sure that they're practicing as ethically as possible. In more recent years, telehealth is actually a solution to this problem. So now we can have people, living in one area and having clients from a totally different area, which you can imagine will help alleviate some of these concerns. There can also be a related issue in small communities, which is clients who know each other. So if somebody's having issues with their partner or friend or neighbor, and you might be treating that other person, this can be a concern. In a larger community, it's usually recommended that you would make a referral out for situations like this. But in small communities, it can be hard to avoid this. So let's talk through some examples. And these examples really reflect how it can be a slippery slope. So think about, what would you do in this situation as a therapist who's really trying to be an ethical practitioner? So for example one, we have Dr. Green, who's working with a college student, Annie. After session, she notices that Annie's car doesn't start. She considers offering her a ride to campus, and she's heading there anyway. So what do you think? Should she offer Annie a ride? It's a nice thing to do, but it can be a bit of a fuzzy area in terms of multiple relationships. Another example, we have Dr. Kai, who's treating Amy for anxiety. And after a few sessions, she's getting to know Amy, and she learns that Amy's sister is a parent volunteer that she personally knows from her daughter's preschool because they volunteer together. And so can Dr. Kai continue her social relationship with Amy's sister? And then we have a third example. So let's say we have James, who was a client with Dr. Maslow back in 2018 for about 6 months. And he recently moved into Dr. Maslow's building in the apartment next door. James wants to invite Dr. Maslow over just for a friendly cup of coffee, just to socialize his neighbors. So should Dr. Maslow accept this invitation? And so with each of these examples, you can see that there's not necessarily one clear-cut answer. I think it really depends on which community you live in, the nature of the work you were doing with the client. There's a lot of different factors involved. And so in thinking about which direction to take, we can return to our 5 general ethical principles. And again, there's not necessarily one right answer here. There's a lot of different options here. But I think a broad one that often comes into play with these multiple relationships are beneficence and non-maleficence versus respect for people's rights and dignity. So beneficence and non-maleficence is pretty straightforward. We're wanting to not harm our clients by having multiple relationships with them. Respect for people's rights and dignity is a little bit interesting because it can actually be applied to the psychologist or the therapist themselves. So if you live in a small community, you have the right to continue working in that community, continue living in that community. So if we think about the example where Dr. Kai has a child at a preschool where her client's sister is also a parent volunteer, it would be an unrealistic expectation for Dr. Kai to have to transfer her daughter out of a different school and move to a different school to kind of change her life in that way. So at a broad level, we can also think about the psychologist as a person and their right to live in their community and weighing that against wanting to minimize harm to their clients. So there's other issues related to multiple relationships and setting boundaries. So sometimes clients will want to give gifts, and this is generally not recommended to accept gifts from clients. However, you can imagine this is very cultural dependent. So in Hawaii, for example, it's not too uncommon to be offered like fruit or like a small gift. And for the sake of the therapeutic relationship and kind of a cultural understanding, it can make sense to accept that gift. But if clients are bringing like a bottle of wine or a gift card, it might be better to decline the gift and kind of explain that you just don't accept gifts from clients. Nowadays, a lot of times clients might find you on social media and make requests. And it's really important to kind of proactively think about boundaries around that. And lastly, thinking about how much you as the therapist want to talk about yourself in therapy. I'm posting a separate video that really nicely outlines this issue. And if you are planning on more training in how to become a therapist, this is definitely something that gets discussed a lot. It can vary from person to person, their comfort level. So some people kind of feel that sharing about themselves helps improve the therapeutic relationship and kind of validates the client. Whereas other people believe that the therapist should just be professional, focus on the client. So please watch that other video that's posted on Perusal for that discussion. So next we'll discuss competence. So what does it mean to be a competent psychologist? You could say that it's psychologists who are sufficiently capable, skilled, experienced, and expert to adequately complete the professional tasks that they undertake. And so, thinking about the boundaries of competence. So psychologists should really plan to only work in their areas of expertise. And being licensed as a psychologist does not necessarily mean that one is an expert in all related fields. So if you're a psychologist who never received training in how to work with children, it would be outside your boundary of competence to take on children as clients. There's also certain specialty areas such as neuropsychological assessments that require extra training to be ethically providing that service. And so this is up to the psychologist to make good ethical decisions about this, because being licensed is kind of just this broad thing that says you're allowed to practice psychology, but you need to kind of think about what are you ethically trained in? Where is your expertise? What services can you ethically provide? And part of this is remaining competent. So a lot of states require continuing education credits. So what this means is every year you have to attend a certain number of trainings to kind of show that you're continuing to learn about current things in the field, current techniques. And another part of competence that we discussed last week is cultural competence. And again, this should be an ongoing process as well. And so thinking about some ethical dilemmas that can arise with competence, psychologists are people too, and they may experience some personal problems that may start to impact their work. And it's important for the psychologist to take appropriate measures and determine whether they should limit, suspend, or terminate their work-related duties when a major personal problem arises. So this could be like a major life event or a trauma that is impacting their day-to-day functioning and ability to be a therapist. It can also relate to burnout, which is the state of exhaustion that relates to, continuous engagement in emotionally demanding work. And burnout is considered to be like exceeding the normal stresses of a job. It can result in like a serious mental health concern that can really impact the psychologist's ability to deliver good care. And so it's really important for psychologists to be mindful of their own feelings of burnout, to really engage in self-care and take that seriously, and to establish strong support systems. So when we think about competence and burnout, this time I'm not going to tell you what I think. I want you to kind of think for a moment and comment what you think, which ethical principles come into play here. And again, there's no right or wrong answer. I think a lot of these come into play for a lot of ethical dilemmas, and it's up to the individual person to kind of think about how they're going to approach the situation. So feel free and comment, and I'm curious to see what people have to say. We can also return to Celia Fisher's ethical decision-making model to help think about how we can handle a situation such as burnout and competence. So I want you to think for a moment, which of these steps might be particularly useful when dealing with an issue of potential burnout and issues of competence. So I think consulting with a colleague is a very good option here. I think consultation should be an ongoing process, and it can really help with this issue of competence. So consultation is recommended as an ongoing practice for all therapists. Some people do this in a formal way. So there are like weekly consultation groups. You can also pay for supervision services, but it can also be informal, just knowing that you have a network of colleagues to consult with when things come up. If somebody moves to a new area or lacks connections with other practitioners, there are professional societies. So for example, the Hawaii Psychological Association, which can be a really good place to seek consultation. And so this is really helpful in being proactive. So before an ethical dilemma arises, making sure that there are people to consult with on an ongoing basis. Lastly, we will talk about ethics in clinical assessment. So this can relate to competence in test selection. So psychologists should only utilize tests they are competent in and knowledgeable about. So again, if somebody has not received additional training in neuropsychological assessment, they should be cautious about interpreting and reporting those results. And psychologists should be using the most recent and applicable measures available. So every decade or so, usually a new cognitive assessment comes out. And it's really important that psychologists use their continuing education and make sure that they're using the most up-to-date tests. They also need to ensure that the tests they use are a good fit for their clients. So not just paying attention to age range, but also the presenting problem and the function of the test. And we're going to talk more about this during the week that we talk about assessments. There are also ethical concerns about test security. So with psychological assessments, psychologists are not to widely share the questions and items with the public. So there's a lot of security around testing, and this is to keep the fidelity of the test. So if people could study for it, it would kind of ruin the purpose, because the purpose is to just take a snapshot of somebody's cognitive functioning. It's not intended to measure how well they can study for a test. And lastly, test data is also important in terms of ethics. So psychologists should be sure that their responses and information are kept confidential, and that the way that the test results are reported are carefully considered in terms of the function of the test. So given the bad history with IQ tests and their misuse, this is particularly important for psychologists to consider what is happening with the testing data.